Hello everyone, thanks for joining us today. Today we'll be reviewing the 2010 medical plan benefits. All of the information that we'll review today will be available in your guidebooks and also online at miami.edu/benefits. Before we review the medical plan benefits for 2010, I'd like to take a moment to explain to you how our medical plan works. Our university health plan covers approximately 22,000 people, including employees, spouses, domestic partners, and children. And our university health plan is self-insured, meaning that you and the university pay the cost of all of the medical claims in our plans. Aetna is paid an administrative fee to perform customer service functions, issue ID cards, and such. So all of the health care expense is paid by you and the university. The total cost of our health plan next year is expected to increase to about $112 million. The university picks up about 80% of that cost, roughly $90 million, and the rest come from employees and their family members in two ways. Number one, the amounts that employees pay in their payroll deduction for premiums, and secondly, the amounts that folks pay in terms of co-pays and other out-of-pocket expenses when they use the benefits. Our focus in 2010 will be on getting healthy and staying healthy, so we want you to take action for your health. Now let's take a moment to review the medical plans themselves. First, all of the plans are open access, meaning that you don't have to select a primary care physician and you don't have to get referrals to see specialists, but it is recommended that you still have a primary care physician. All of our plans have national networks, meaning doctors and hospitals in all 50 states. All of our plans cover preventive care free of charge, and they all gain access or allow you access to Aetna's free health and wellness programs.
I know that my annual physical is free. What else is included in my free preventive care benefits?
The preventive care benefits include age and gender appropriate preventive care services for everyone covered under our plan. Things like annual mammograms, colonoscopy, well woman exams, well child visits, and immunizations. But our website is really the best place to get all that information. And again, all of those preventive care benefits are covered free in all four of our medical plans. In our medical plans, we have 2 HMOs and 2 PPOs. An HMO is an HMO because you must use Aetna network doctors and hospitals for all of your medical care unless you have an emergency. Emergencies are covered anywhere in the world, just as though you were at an in-network hospital when it happened. PPOs pay a higher benefit when you use Aetna network doctors and hospitals, but you can also go to a provider who doesn't accept Aetna, and the plan will pay a limited benefit for that. Our 2 HMOs are called Aetna Select 1 and Aetna Select 2, and the difference there is really how you prefer to pay for health care.
Can you give me an example?
Sure. Aetna Select 1 and Select 2 function just like car insurance or homeowner's insurance. In Aetna Select 1, you pay a higher monthly premium, but you have lower co-pays and no deductible when you use medical services. Aetna Select 2 is just the opposite. You have lower monthly premium, but you will have a deductible, and you will have higher co-pays when you use medical services. So it's really just about how you prefer to pay for health care.
Okay, well, I'm curious about the HRA plan. Why are the premiums so low?
This plan is set up a little bit differently than the others. The folks who choose this plan tend to be better consumers of health care, and so the premiums are lower as a result. Let me give you a quick example of how the plan works. The plan is a PPO, and it has a fund of $600 per member in the plan, and that fund is paid by the university, and it's held in an account at Aetna. The fund covers the first $600 of prescription or medical expenses that you have during the year. The plan also has a $1,500 deductible. That $600 fund, though, goes to pay the first $600 of your deductible. So, for example, if you take employee-only coverage, you have a $1,500 deductible. The university is covering the first $600 of that deductible, so your actual deductible is really $900. The plan also has a couple of other interesting features, namely the out-of-pocket maximum. The out-of-pocket maximum is the maximum amount that you might pay in a given year if you become very, very sick. And after you reach that point, the university begins to pay all of your health care expenses entirely for the remainder of the year. So again, this plan has the lowest out-of-pocket maximum. And additionally, this is the only plan of all of the ones that we offer that includes your medical and your prescription drug expenses in that out-of-pocket maximum.
Can you tell me exactly what comes out of the $600 fund and later the deductibles?
Sure. It works a little differently, again, than the other plans. In this plan, I'll give you an example. If you take Crestor, Crestor actually costs about $130 under the medical plan, even though it has a copay of $35. The entire $130 will be deducted from your fund, and you'll pay nothing at the pharmacy. If you keep using medical services or purchasing prescription drugs, eventually the fund will run out, and then you'll be in your deductible phase. If you need to pick up a prescription or get a medical service at that point, for example, the Crestor again, then you will actually pay the $130 to the pharmacy, and it'll be part of your deductible. After you meet your deductible, you'll pay the $35 copay for the Crestor, just like in all of the other plans.
So I think I got it. So should I look at the total cost of the medical expenses and prescription to estimate the cost and not the copay that I pay?
Correct. You need to look at the total cost. And we have on our benefits website, which again is miami.edu/benefits, some health plan examples for folks with employee-only coverage all the way through family coverage to help you see what your expenses might be under each of the plans.
Will my prescription be in the same copay tier next year?
It may or it may not. Our prescription copays themselves aren't changing, so next year they'll still be $10 for generics, $35 for brand drugs, preferred brand drugs, $55 for non-preferred brand, and $100 for specialty injectables and biotech drugs. But every year, all of the insurance companies take a look at every drug that they cover on their formulary, and they may adjust a drug up or down depending on the pricing in the market. There are only a handful of drugs that are moving on our plan, but you still want to look at Aetna.com or the benefits website to see if your drug is one of the few that's going to move up or down next year.
Are there any other changes that we should know about?
There are a small number of changes to the medical plan copays, the first of which is actually a reduction. You'll see a lower copay for specialist visits within the UHealth system in all 4 of the plans, and that's actually a $5 reduction. For the other few copay changes, you can view our benefits website or your guidebook to see the plan design comparison sheet.
Are there any other changes that we should know about?
Yes, there are several important enhancements to the plans in 2010. The first one is that we'll be adding a benefit for the treatment of autism spectrum disorder under our plan. Anyone who has questions about how that benefit works should really refer to the benefits website. We'll also be adding a new generic prescription drug benefit that's available at Walmart. You can still receive your generic prescriptions wherever you're currently getting them, but if there's a Walmart that's close to your home or your office, next year you can get your generics there for a $5 copay. And also we're changing the vision benefit a little bit for the annual eye exam. Next year, you'll be able to take your Aetna card to any Aetna optometrist or ophthalmologist, and you'll get a free eye exam under the plan, or you can take your Aetna card into any of the major retail optical chains like LensCrafters or VisionWorks, and you can get a free eye exam from them as well.
How about our monthly premiums?
Our monthly premiums are changing a little bit, and you'll also notice that the way that they're displayed is a little bit different this year. The first column shows your 2009 monthly premiums. The next column shows what your premiums will be on average in 2010 if you participate in 2 incentive events. And then the third column shows what the premiums will be if you don't participate in those incentive events.
What do you mean by incentives?
Well, we're going to have some events at the beginning of the year, and if you participate in those, you'll receive 2 credits. One credit will be $50, another will be $100, so that you can earn a total of $150 off of your premium. The first event provides a $50 credit, the second a $100 credit, and if you participate in those events, the credit will be paid out to you until the full credit is received. So that's why we're illustrating the average premiums for next year.